Welcome to this educational program. This module provides an introduction to hematospermia. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Hematospermia is a complicated word with a simple meaning. Hemato refers to blood, and spermia relates to sperm. So hematospermia means blood in the semen or ejaculate. Semen is the fluid released during orgasm that contains sperm from the testicles and fluid from the prostate and seminal vesicles, which are explained further in just a moment. Your doctor may also refer to this condition as hemospermia. It means the same thing. Blood mixed in with the semen may be simple for some men to identify, but many men may not visualize their ejaculate, so it may go unnoticed for some time. Furthermore, it is usually painless and not associated with other symptoms. It is important to differentiate hematospermia from other sources of bleeding, including blood in the urine, called hematuria, and blood from one's partner, either vaginal bleeding or rectal bleeding. The so-called condom test can be used if there is any question, whereby semen can be collected in a condom during intercourse and inspected. This is an image of the male genitourinary tract. Hematospermia most commonly is a result of conditions affecting any of these many structures involved in the production and release of semen. Semen consists of sperm and fluid from other organs. Sperm is made in the testicles and travels through the tiny tubes of the epididymis and into the vas deferens, and finally into the ejaculatory ducts. It then mixes with fluid from the seminal vesicles and prostate in the process called emission, just before ejaculation, when semen is released at orgasm or climax. Tiny glands, called Cooper's glands, also provide a small amount of fluid. During orgasm and ejaculation, semen passes out of the body through a long tube within the penis called the urethra, which is also the tube that urine passes out through. This diagram shows another view of the male reproductive organs in detail. There are no hard and fast numbers documented that tell us how common hematospermia is. It does affect men worldwide, and it is estimated that about 1% of men presenting to a doctor with a genitourinary complaint have hematospermia. In North America, it seems to affect males of all ages, after puberty or adolescence. It is most commonly brought to the attention of doctors by men between the ages of 30 and 40. So how does blood get into your semen? These days, most hematospermia is actually the result of interventions such as prostate biopsies, prostate cancer treatment, or surgery on the testicles or vas deferens. When no such interventions can be blamed, then most often hematospermia is caused by inflammation of the male sexual organs, especially the seminal vesicles, ejaculatory ducts, prostate, and epididymis. Hematospermia can also occur following trauma to the pelvic region or obstruction of the ejaculatory system from such things such as cysts. Tumors of the genitourinary organs can also cause blood in the semen. In some instances, the cause of a man's hematospermia may be difficult to pinpoint or even remain undetermined. Sometimes it is blamed on prolonged abstinence, or conversely, on overly frequent sex or masturbation. We will discuss each of these causes of hematospermia in the next few slides. Inflammation is the body's way of responding to a variety of triggers, including irritation, trauma, obstruction, infection, and tumors, to name a few. Inflammation leads to swelling of the affected part, and this sometimes can cause bleeding. Nonspecific inflammation of the semen-producing structures, such as the seminal vesicles, is considered to be the most common cause of hematospermia. The good news here is that even after a full evaluation, usually no obvious cause is found. In particular, it is usually not related to either cancer or even infection. Furthermore, the hematospermia in these cases usually goes away over time, and no treatment is required. Other cases of hematospermia brought to the attention of a doctor are caused by a microbe or an infectious agent. Some of the common microbes seen with hematospermia are bacterial, viral, or parasitic, with bacteria causing most cases in North America. Bacterial germs associated with blood in the semen include the sexually transmitted organisms chlamydia, ureaplasma, and gonorrhea, as well as enterococcus, a bug normally found in the intestines, and the organism causing tuberculosis, or TB. Viral agents causing bloody semen can include the sexually transmitted AIDS virus or herpes virus. Certain tropical parasites are also associated with blood in the urine and semen, and the most common one is called schistosomiasis, which is a blood fluke that humans can contract through their skin from contaminated water. Approximately 2% of cases of hematospermia are thought to be caused by physical injury. When the cause of hematospermia is determined to be from physical trauma, it may have come about in a number of ways. Jarring of the pelvic region, especially the perineal area, the part between the rectum and scrotum, such as may occur from bumpy vehicles or bicycle rides, may cause blood to appear in the semen. As mentioned earlier, hematospermia may be seen after you've had a medical procedure involving your sexual organs. For example, if you've recently undergone a vasectomy, had a prostate biopsy, or an instrument was inserted into your urethra, you may temporarily see blood in your ejaculate. Physical obstruction of the sexual organs may also cause hematospermia. If something is physically blocking ducts or tubes in the semen's pathway, pressure may build up and cause nearby blood vessels to leak blood into the semen. Typically, the prostate, ejaculatory ducts, seminal vesicles, or urethra are the affected structures. Obstruction may be caused by cysts, which are lumps or swellings that are usually not cancerous, calculi, which are mineral deposits that cause stones that plug off ducts, or tumors. Tumors are growing clusters of cells, and these may be non-cancerous, or benign, or cancerous. Prostate tumors are the most common tumors to cause blood in the semen, although rarely, tumors arising from the testicles or seminal vesicles can also do this. So-called systemic conditions can be rare causes of blood in the semen. These are diseases or conditions that affect multiple areas of the body, not just the genitourinary system, and can include things like high blood pressure, called hypertension, liver disease, bleeding disorders such as hemophilia, and lymphoma or leukemia. You may wonder if you are infectious or contagious in any way when you are passing blood in the semen. In most cases, hematospermia is not infectious. But, and this is a big exception, if your hematospermia might be caused by an infectious agent like chlamydia, for example, then you may be advised to practice safe sex, at least until you've been fully diagnosed and treated. Your doctor can advise you further about this. You may wonder if seeing blood in your semen is a cause for concern with your fertility. Will this affect your ability to have children? Well, it depends on the underlying cause, but in most cases, rest assured that it will not. If the hematospermia is caused by nonspecific inflammation only, then you will likely not experience any negative consequences. If it turns out your bloody ejaculate is caused by certain infections, then yes, you may not be able to conceive children without medical help. Other infections, however, may not affect your fertility. If your bleeding is caused by cysts, benign tumors, or other structural blockages of your ejaculatory system, then you may require surgical correction of the obstruction. If you are diagnosed with prostate cancer and undergo surgery or chemotherapy, your fertility will be affected. Your doctor can best advise you about the specifics of your situation. Most men who see blood in their ejaculate go to see their doctor. Your family doctor will do an initial assessment and then decide if you need to be referred to a urologist, who is a physician specializing in diagnosing and treating all types of genitourinary disease. Whichever physician you work with will give you an interview and examination, and order laboratory tests and perhaps other procedures that will help determine what may be causing this symptom. In taking a detailed medical history, your doctor may ask you specific questions about your urinary and sexual symptoms. Typical questions may include, how frequently do you ejaculate? Do you see blood in the semen each time? How much blood have you seen in your ejaculate? Do you have any other symptoms, and what are they? Have you had any medical procedures recently? In particular, have you had a prostate biopsy? Do you feel compelled to urinate, but discomfort when you do? Is there blood in your urine? Is it painful in your midsection and genital area? Do you have a family history of prostate cancer? You'll also need to come prepared with a complete list of medications you are taking and allergies that you might have. Anything at all that you think may be relevant, you should be sure to mention to your doctor. After taking your history, your doctor will move on to the physical examination. Your temperature and blood pressure may be measured first to rule out an active infection or high blood pressure. Your doctor will examine your penis and genital area. More than likely, your doctor will also perform a digital rectal examination, which is an important way by which your doctor can determine the size and shape of your prostate, as well as the seminal vesicles. The figure here shows how a finger in the rectum can feel one surface of the prostate. The seminal vesicles normally cannot be felt, but if they are enlarged, they may be detected this way. Your doctor may have you collect urine, semen, and blood samples for testing in the lab to rule out infection, prostate cancer, or other disorders. Rarely, he or she may also collect swabs from the penis and inside the opening of the urethra. In most cases of young men with non-persistent hematospermia, a simple urine test may be all that is required. From this, the lab can look for red blood cells and signs of infection or inflammation. When felt to be necessary, a highly sensitive lab test can also detect the presence of chlamydia in the urine. In rare cases, semen and swabs of urethral secretions can be examined for blood and can be cultured for bacteria. When indicated, blood samples can be examined under a microscope for white blood cells and tested for certain sexually transmitted diseases such as herpes. Blood can also be tested for levels of prostate-specific antigen, or PSA. PSA is an enzyme that is made by the prostate to keep semen at the right consistency for pregnancy. Elevated blood levels of PSA can indicate an enlarged prostate, prostate cancer, or an inflamed prostate, called prostatitis. PSA is described in more detail in its own module. After the patient history and all lab testing is done, the diagnosis may still not be clear. In this case, your physician may wish to order some special imaging tests to rule out other genitourinary problems or structural issues. A picture is worth 1,000 words. Likewise, a medical image can provide insight to your doctor that the physical exam and lab tests may not. In many instances, a urologist may order a special imaging test of the prostate and ejaculatory system called a trans-rectal ultrasound. In rare cases, other testing, including cystoscopy or other diagnostic imaging testing, may be warranted. Trans-rectal ultrasound uses sound waves to produce an image of your prostate and seminal vesicles. This is an excellent way to test for obstruction, inflammation, or cancer. With trans-rectal ultrasound, a thin ultrasound probe called a transducer is inserted into your rectum. This will feel slightly uncomfortable but not painful, much like the digital rectal exam. If there is a question about prostate cancer, biopsies of the prostate can be undertaken at the time of the ultrasound evaluation. A cystoscopy is a procedure that uses a small, flexible scope with a lens and a light to view the urethra, prostate, and bladder. The doctor will first numb the urethra or urine channel inside your penis with an anesthetic jelly, and then insert a small flexible telescope into the urethra. The images from the scope are usually displayed on a video screen, allowing the doctor to determine the size of your prostate gland and to rule out any other problems in the urethra or bladder. This procedure is described in detail in its own module. Diagnostic imaging procedures such as ultrasound, computed tomography or CT scan, and magnetic resonance imaging or MRI use sound waves, X-rays, and magnetic fields respectively to provide a picture of your body's organs. These imaging techniques give your doctor a picture of any structural abnormalities that may be causing hematospermia. However, they are rarely necessary or indicated in the initial evaluation. The treatment of hematospermia depends on the underlying cause. In most cases, no concerning problem is found, and without any intervention, the bleeding will clear up on its own with no consequences. In other situations, treatment is required to target the underlying cause, and occasional patients may require invasive procedures to fix these problems. This slide simplifies how most cases of hematospermia are approached. Individual situations, of course, and the preferences of individual doctors will vary. Generally, younger men with just 1 or 2 episodes of blood in their semen will undergo a very simple evaluation with a medical interview, physical exam, and basic urine tests. A trans-rectal ultrasound may or may not be done. Assuming the results of those tests are negative, the man will simply be reassured and possibly followed up at a later date. In a younger man who has more persistent blood in the semen, or in an older man, a more complete evaluation may be undertaken, depending on the situation and the doctor's preference. This might include special urine and blood testing, cultures, cystoscopy, and other imaging tests. Treatment in these situations will depend on whatever cause for the hematospermia is found. This table outlines many of the causes of hematospermia, as well as ways to manage each and the usual outcomes. As mentioned, nonspecific inflammation of the seminal vesicles and ejaculatory system usually requires no specific treatment, and the bleeding usually clears with no further effects. Infectious causes are generally treated with the appropriate antimicrobial agent with good cure rates in most cases. If it is discovered that repetitive trauma is the cause, avoiding the source and letting your body heal itself will generally allow the hematospermia to settle. Obstructions, such as cysts or benign tumors, may be aspirated, drained, or repaired using ultrasound guidance or traditional surgical techniques. High blood pressure may be effectively managed with medications. Other systemic diseases may require a variety of different treatments. If you do suffer from hematospermia, seek medical help, but rest assured that most cases are caused by non-cancerous conditions. With a thorough evaluation, your doctor should be able to provide you with tools to manage or cure this condition. In summary, hematospermia is blood in the semen. It is a common problem in sexually mature males and may affect men aged 14 to 75. Hematospermia is really only a symptom of other disorders. Most of these underlying causes are associated with the male urogenital system, and they can be inflammatory or infectious in nature, or caused by trauma or obstruction. The most common cause is nonspecific inflammation of the seminal vesicles or other parts of the ejaculatory system. In rare cases, hematospermia may signal prostate cancer in older men. When you visit the doctor with a complaint of hematospermia, he or she will conduct a medical interview and physical exam, which will include a digital rectal examination of your prostate. Lab tests and a trans-rectal ultrasound may also be required. All of this testing will allow your doctor to prescribe you the best advice and treatment for your specific situation. These resources on the Internet may help you find further information or support about your condition. These current references were used to assist in the preparation of this module. All of these are available through your local medical library if you are interested in more detailed reading on this subject. We sincerely hope that this module has furthered your understanding of hematospermia. We wish you the best for the future, and thank you once again for viewing this educational program.